Hi, my name's Doug and I'm going to talk to you today about rib pain. Now if you've ever suffered from an aching pain under your shoulder blade, it feels like a knife in your back when it's really bad, it can come all the way around and even give you pain in the chest, well, it's quite possibly a rib problem. Okay, ribs are a very common problem that we see in the clinic, and it's very simple to treat, but I'm going to give you some information today about what it's all about. Okay, have you ever noticed that it's really hard to get to sleep at night because your shoulder aches? Well, it's possibly a rib problem. Now, most commonly it's a sharp pain under the shoulder blade, just off to the side of your spine. It can radiate all the way around, and as I said before, can also give you pain in the chest. Often people think they're having heart problems or chest problems, chest pains, and it's not actually that. So they go and get checked out, the doctor says there's nothing wrong. Well, then if that's happened to you, it's probably a rib problem. Now you can get acute or chronic cases of rib pain. Acute is where it comes on very quickly, and there's usually a cause. So most commonly it's from an accident, so a rugby tackle, or if you fall and hurt yourself. You can often get it when you're sneezing. Most commonly it's due to being in a twisted position and jerking your spine. Okay, very common for people picking up a suitcase and throwing it in the back of the car to get a rib problem. Now chronic cases is where it's been there for a while and it just keeps coming back. And in those cases usually it's to do with a repetitive activity where you're in a twisted position, or something where your arms are up high. So I get it when I play guitar. Often hairdressers get it, computer workers, if they're bent forward using the mouse all day long. That's a very common cause for chronic rib pain. Now, why do ribs get sore? It's all to do with your body's anatomy. Okay? Now the ribs attach at the back on either side of your spine, and they run around and they join to your breastbone at the front. And what your ribs do is they help you breathe, but they also provide protection for the very important internal organs like your lungs, your heart, etc. But with the increased protection comes decreased mobility. And so because they attach at the front and the back, if you get a rotation in the spine, the ribs can't easily twist. So what happens, instead of twisting, the ribs torsion a bit to allow that rotation to occur. And what that torsion does is that causes the joint at the front here and at the back here to stretch, and that causes inflammation. And where you get inflammation, you get pain. And the great thing about ribs is that they constantly move. Every time you take a breath, your ribs are moving. So if you've got a twist there and it gets inflamed, it's going to be constantly sore. Now often ribs are associated with other symptoms. Most commonly that's neck pain, headaches. Okay, as I said before, chest pain, and a very common one is an ache going into the arm, possibly even numbness or pins and needles in the arm or hands. Okay, and that's due to pressure on the nerve where the rib's compressing it as it passes through the shoulder. So how can posture affect my ribs? Well, basically posture is the position you hold your body in to keep it upright and balanced. Okay, as soon as something changes, we automatically alter our posture to keep our body balanced. And that postural change causes a rotation or a bend to occur in the spine. And our body holds ourselves in those positions for a long time. And as I said before, it's that bend that causes the ribs to torsion, which causes the inflammation and the pain. Okay, if you're doing with work or with repetitive activities, a certain posture where you're twisted or you're bent over like on a computer or like a hairdresser, then the many hours held in that position puts pressure on your body. So how do we treat ribs? Well, the best way I know of treating a rib problem is to get it adjusted by a chiropractor. What you find with a chiropractic adjustment of the rib is that at the instant it occurs it's uncomfortable, but you get almost instantaneous relief. And in my experience over the years, I've found that most of the time you'll sort something out within 3 or 4 treatments. Okay, you also need to identify the postural issue that's created it in the first place and fix that as well. So why don't you come into the clinic? We're at the Ryde Holistic Wellness Centre. We're at Top Ryde, Suite 4, number 10, Pope Street, and that's just across the road from the Top Ryde Shopping Centre. The phone number here is 9808 1377. Thanks.